Hello, dear doctors. I would like to welcome you at Dr. Ramy Cardio Club. Today, I'm gonna take you in a very exciting journey of knowledge and success to be excellent in answering any question regarding pharmacology basics. Pharmacology basics for many of us is something hard, but today you're gonna figure out that it is very simple, more than we were thinking. So let's take off and learn together. In the beginning, I would like to start with a very lovely question. Which of the following parameters is used to indicate the ability of a drug to produce the desired effect relative to a toxic effect? Is that potency, intrinsic activity, therapeutic index, efficacy, bioavailability? Which one of them? We should learn the meaning of every one so we cannot choose. So just keep your answer in your mind and follow me, and then we're gonna get back again to the question. Okay. Potency of a drug. It is the relative measure of the amount of the drug needed to produce a desired response. Amount of the drug that will produce a desired response. Okay. What's interesting? It is determined by the affinity of a drug for its receptor. Oh, now it is making sense. If the drug has a very, very, very high affinity for its receptor, little amount of it will be needed to produce a desired action. But if the opposite, much bigger doses shall be needed to produce the same action. So if I'm comparing two medications, the drug A and the drug B, and I'm gonna use only 1 milligram of drug A to produce an action, and I will use 100 milligrams of drug B to produce the same level of action. So which one will be potent? Which one will be more potent? Of course, drug A, because little amount should produce an action. This will give me an impression that it has higher affinity for its receptors. From this, we got another term, which is the ED50, to compare medications together. So, what is the ED50? ED50 is a dose that produces the half maximal response, and it is considered the threshold dose at which the first noticeable effect should happen. So if you are comparing potency of two drugs, just compare the ED50 of both. The relative potency of a drug can be demonstrated by comparing the ED50 values of two full agonists, which means the drug with lower ED50 should be more potent. Alright? How about intrinsic activity of a drug? Intrinsic activity of a drug is the ability of the drug to elicit a response, which could be full agonist, partial agonist, competitive antagonist, reversible or non-reversible, non-competitive antagonist. Which is very interesting to know in details, so we're gonna learn it together in a separate session because it is related to the enzyme kinetics and we should explain it in full details. Okay, so we will have it in another session. Therapeutic index. It is a balance between the desired effect and unwanted toxicity. Oh my god, now we got the answer. I think this is the answer of our question. The therapeutic index is calculated as the TD50 over ED50, which means the ratio between the dose that produce a toxic effect in half of the population to the dose that produces the desired effect in half of the population. Because sometimes we know that this medication in this dose is a therapeutic one, but if you have much bigger doses, it is a toxic dose. A toxic dose. For example, you are giving a patient a medication as antiplatelet. For example, it's drug X, antiplatelet. In this dose, it just causes antiplatelet activity, but the patient should not have bleeding. But if the patient increased the dose from 1 tablet to 10 tablets, this is toxic dose. Bleeding may happen. Gastric ulcer may happen. I will consider this a toxic dose of the drug. A toxic dose. It may cause kidney problem, hepatic problem, whatever. So this will not be a therapeutic dose. It is a toxic dose. So the therapeutic index is very important, because sometimes the therapeutic index is very small. What does it mean? If you take 1 milligram, for example, if you take 1 milligram of the medication, you get a very lovely response. This is the desired therapeutic effect. If you take 1 milligram and half, you're going to have a toxic problem, you're going to have a hepatic problem, you're going to have a kidney problem. So this will be a toxic dose. It's very narrow ratio. Just half milligrams. Yes, this is narrow therapeutic index, very small therapeutic index. Okay, you got it? This is very important to know. The efficacy of a drug. Oh my God, they always play with this. The efficacy of a drug and the potency of a drug. What is the difference between them in MCQs, in oral exams? The efficacy of a drug is the ability of a drug to produce the desired pharmacologic response. That is the ability of the drug to elicit the pharmacologic response, which is determined by many factors like number of drug receptor complexes formed, the ability of a drug to activate the receptor once it is bound to it, the status of the target organ or cell. Is it ready for the drug to work on it or not? For example, regarding this, a new medication for diabetes is the SGLT2 inhibitors, sodium glucose transporter 2 inhibitors, which permits the passage of glucose through the kidneys out in the urine, because it inhibits the glucose to be reabsorbed in the proximal convoluted tubules of the nephrons. This medication, they always tell us just to use it if the kidney is healthy. Don't use it if the creatinine clearance is below 45. Why? Is that because it will cause harmful effects on the kidneys? No, it will not hurt the kidney. Just it will not work. It needs healthy kidney to work. But actually it is not toxic to the kidneys. It works on the kidneys, yes, this is correct, but it doesn't cause any harmful effects. So the status of a target organ or cell is very important for the drug to be effective, to produce an action. So again, how can you compare efficacy between drugs? For example, Remember the painkiller while we were talking about potency? Okay, I would like to compare between drug A and drug B. I will get two patients complains of severe pain. On a scale from 0 to 10, they said my pain is 10. So I gave drug A to relieve the pain. After giving drug A, the patient said the pain now is 6. After giving drug B, the patient said the pain now is 4. So which one is more effective? Drug B, of course, because I got more pharmacologic response. In this situation, I cannot say that drug B is more potent than drug A. No, it is not. It is more effective, not more potent. To compare potency, you compare between two drugs achieved the same level of response, but in different amounts. Okay? This is the trick. Just watch. Last thing to learn today, bioavailability. It is a fraction of an administered drug that reaches the systemic circulation. You should know that if you are giving a medication through intravenous route to a patient, the bioavailability will be, yes, exactly, 100%. 100%. If you are giving it through other routes, subcutaneous injections, intramuscular injections, inhalation, oral route, sublingual, it will be determined by other factors like the surface area of the absorptive site. For example, if your patient has short bowel because he had colonic resection in the past due to colon cancer, and you are giving an oral medication, do you think that the bioavailability will be the same as in another one, healthy, didn't have any surgeries or resections of the stomach? The absorptive site is different. So it will be affecting the bioavailability of the drug. Drug pKa, the pH of the surroundings. Drug molecular size, which will help it through crossing the cell membranes. All these factors should affect the bioavailability of the drug. So back to our question we just answered. Which of the following parameters is used to indicate the ability of a drug to produce the desired therapeutic effect relative to a toxic effect? You should know the correct answer now. It is the therapeutic index. Yeah, the answer is C, the therapeutic index. My beloved doctors, I wish you the best of luck while you are studying and reviewing for your exams, and I will be welcoming your comments, your questions. You send to us. I'm gonna answer them all. And if you like our session, you can subscribe to the channel so you can get the whole series wherever we update our channel. Once again, good luck. I see you again. Bye bye.